Hi everyone, and thank you for joining VNAA for this presentation on our new VNAA Healthcare Transformation e-Toolkit. My name is Molly Smith. I am the Vice President for Policy and Innovation at VNAA. Before we get started, I just want to recognize folks who have contributed to the VNAA Toolkit. We have the VNAA Value-Based Purchasing Coalition, as well as a number of VNAA staff and expert advisors who have been working with us on this tool. And I will just take this moment not only to thank them, but to plug the opportunity for you to contribute or to participate in the further development of this toolkit, as it is very much an ongoing and iterative process that we are undertaking here, just given the pace of transformation occurring in the healthcare system. So why don't we begin with some context for this toolkit. I think that many of these trends impacting the home-based care sector will be very familiar to you, but I do just want to reiterate how we see some of these things, what the implications are really for our industry. So of course we have an aging population, and one that is unique in history in its prevalence of chronic disease. So we not only have a much older population, but we have individuals who are aging with multiple chronic conditions. Oftentimes these chronic conditions are appearing as early as their late 30s, their 40s, and their 50s, and then maintaining throughout their later years. We have incredible focus on new care delivery models, so that's the way in which the healthcare system is organized to deliver services to individuals who need them, and payment models to support these new ways of delivering care. We have technology and workforce advances that are really changing the way in which we can deliver care, making it much more safer to deliver care in settings other than inpatient facilities. So for you and your work, of course, you know this best. What we can now do, for instance, in the home and in outpatient settings in the community is really remarkable. You know, both, again, through the use of technology, through the advancement of certain pharmaceuticals, and you know, the advancement in the training of our workforce. And then finally, we have a real focus on the patient experience of care. And there's a couple of elements to this. It's really a recognition that plans of care are only as successful as they are in being followed by the patient and their caregiver. So it's really important that plans of care take into account what is realistic for the individuals for whom they are designed. And also this idea of patients or people as less patients and more as consumers of healthcare. So a real focus on meeting the needs of consumers who clearly have a huge financial stake, as well as, of course, health stake in the healthcare that they receive. Really the biggest implication for our industry from our perspective is just an incredible opportunity for exponential growth. We have estimates that the number of individuals who will be receiving long-term care services and supports is anticipated to increase from 15 million in 2013 to 27 million in 2050. We have anticipate expectations for growth in home health expenditures from 80 billion, that should be with a B today, to 137 billion in 2020. And we're seeing real increases in the number of U.S. deaths in hospice. Also not mentioned here on the slide, but also a trend that we're seeing is growth in community-based or home-based palliative care programs. And these opportunities are really happening across the spectrum. So while home health in particular has really been sort of siloed in the Medicare program into the post-acute care space, we're really seeing opportunities for home-based care in primary care and prevention with things like risk assessments, and wellness programs that happen in the home, in employers' offices, and other places in the community. Chronic care management, so sort of beyond just the skilled services that have been traditionally delivered to individuals in a post-acute and in some limited instances long-term care with long-term care needs. But this is really managing over a much longer period of time individuals with chronic conditions. Advanced illness, the delivery of palliative care models, and new ways of delivering services for individuals near the end of life. So there's really just an incredible amount of opportunity for home-based care providers in this new world, or this world sort of post healthcare world post-transformation. But our industry faces a number of challenges. We've got a number of statutory and regulatory barriers that I'll talk about in a minute, but we also have an issue with our own readiness for transformation. So with respect to statutory and regulatory barriers, I think one of the biggest challenges we face is that the Medicare program, which is our primary payer and the primary source of coverage for most elderly individuals in the U.S., does not cover long-term care services. There are minimal benefits around, around long-term care, but really it was designed to be an acute care program, and largely an acute care program around hospital stays in particular. We have consistently been facing downward pressure on rates, which, as we can talk about more, has real implications for our ability to develop the infrastructure to transform the way that we deliver care. And then finally, most of the care delivery and payment innovation that has already been started is really focused around hospitals and physicians. And while there is some reasonable rationale for that, it's definitely where the bulk of the dollars are spent in the Medicare program, and physicians are also seen in many instances as the quarterback of the care team. What it has meant is that silos that these new models are largely intended to break down still persist, and we're still bumping up against the challenge of being recognized as a valued contributor in new care delivery models. In terms of our own readiness for transformation, while other elements or other providers in the healthcare system have already experienced quite a bit of activity with respect to new care delivery models like ACOs or bundled payments, or new payment models like shared savings or sub-capitation for care coordination services, we largely have been exempt from those programs at this point. And while CMS is talking about launching a home health value-based purchasing demonstration in 2016, we really have very little prior experience here. And while a number of our organizations are participating in models like ACOs or bundled payments, the numbers are still concerning. Right now there are 360 organizations that have contracted with CMS through the Bundled Payment for Care Improvement Program. And within those contracts there are over 1,700 providers, individual provider organizations that are a part of those contracts. Of those, approximately 400 are hospitals, approximately 400 are large physician groups, over 1,000 are nursing homes, and only 100 are home health agencies. So while there is a lot of innovation and different models being tested right now, nationally we're not well represented. And then finally, I will just make mention of the fact that we are highly fragmented in our market. There are more than 11,000 Medicare certified home health agencies nationwide. We vary significantly from very small, regional, not independent agencies, all the way through large integrated delivery systems, and then agencies that are in nearly all 50 states. This can be a challenge for organizations in these new care delivery models, particularly if the models do not align so geographically with how the home-based care providers are organized. I won't belabor this too much, but there are some other sort of specific organizational challenges for home-based care providers. Generally, this, we need to make changes in the way that we deliver services, the way that our services are financed, and how we manage the services that we deliver. Right now, for instance, in general, home-based care providers do not have the care management systems in place that are needed to manage populations We do not have the financial infrastructure like the actuarial or underwriting capabilities. We don't necessarily always have the data or the analytic capabilities to support these models, or the information systems to really communicate across the continuum of care and really manage a patient. And so, therefore, we're seeing a lot of activity within our market with respect to mergers, acquisitions, and partnerships. And for a lot of our members who are smaller or even mid-sized independent agencies, this is increasingly an issue that we expect our members will face in their environment, is what will happen with respect to consolidation or partnerships as organizations are attempting to get scale for contracting purposes. I'd like to transition now to talk about how VNAA intends to support our membership in preparing to participate in a high-value world. We've organized our support services in a sort of three-legged stool. The first is to advocate for supportive policies for home-based care providers. The next is to build on our already existing evidence-based clinical guidelines to ensure that our members have access to the most up-to-date information and research on clinical best practices. And then operational support and providing you with the tools that you need to make changes within your organization, the way that you do business, the analytics capabilities that you have available, your ability to assess your risk for certain models, et cetera, and bring all of that together as a package of tools and services for our member organizations. If we look at our policy work, on the left you will see our 2015 policy agenda for VNAA, and those items that are highlighted in red indicate areas that very much fall into the space of health system transformation. So you'll see that we already have had a significant focus on advocating for supportive policies for the home-based care providers in these new models. Here you can see that there's been a number of initiatives that were introduced in 2015. With respect to transformation, we have some value-based purchasing programs introduced in Congress, also within the administration with the Home Health VBP program. And we have a number of other demonstration projects like the Comprehensive Care for Joint Replacement, a mandatory bundle payment program for hospitals, next-gen ACOs, et cetera. So just a lot of activity. And as all of these initiatives are brought forward and there are opportunities for industry to weigh in, VNAA is there advocating on behalf of the industry and for our members. With respect to evidence-based clinical guidelines and resources, VNAA has the VNAA Blueprint for Excellence, as well as the Clinical Procedures Manual and a learning management system where organizations and their staff can self-learn at their own pace about various operational but primarily clinical best practices to care. And now we really seek to pull it all together with tools for operational support in what we're calling the VNAA Healthcare Transformation e-Toolkit. And the toolkit is intended to have four main components at this point. The first is around care delivery and payment innovation. We have a specific subsection on the home health compare star ratings, a specific section on the home health value-based purchasing demonstration program, and then a section on special issues in Medicaid managed care. Looking back at the first, the care delivery and payment innovation, this section of the toolkit is where you may come if you want to learn more about specific payment and delivery models. So for instance, if in your community to date there are no ACOs, but they are forming, and you want to learn more about what is an ACO, how may I participate in an ACO, what are the different variations of ACOs, you could come to this section and learn about that. We also have readiness assessments so that you can evaluate how ready your organization is to participate in different transformation initiatives. We have risk assessments and management strategies for dealing with different types of risk. We bring care delivery case studies and payment model case studies to you so that you can learn from what other organizations and what other industries have done in this space and done successfully and their lessons learned. And then finally, we have a section on communicating your value to model conveners. So as more programs like ACOs, like bundled payments, like Medicare Advantage and other managed care contracting, as those programs expand and evolve, increasingly we will find ourselves negotiating and contracting not so much with Medicare directly, but with these other organizations. And it's increasingly important that we know how to speak their language and to be able to communicate to them the value that we bring and how we can influence or impact their performance metrics. With respect to the STAR ratings and the Home Health Value-Based Purchasing Demonstration Program, the goal for these sections of the toolkit is to provide links to evidence-based clinical guidelines to really help improve your performance in both of these programs and to provide tools for tracking your performance, tracking and managing your performance. I will mention that both of these sections of the toolkit are still in development, and we will, in later iterations, be updating the content here. This is particularly true of the Home Health Value-Based Purchasing Demonstration Program, as right now that is still just in the proposal form, and later this year is anticipated to be finalized, however, potentially with changes, and therefore we will build our content with the final elements of the program. With respect to Medicaid, I will just mention that in many respects, contracting, particularly with Medicaid managed care, is not necessarily so different than contracting with managed care organizations for purposes of Medicare Advantage or for commercial populations. However, there are some unique things about Medicaid, particularly the role of the state and the role of state policy in helping set the sort of the constructs or the framework for the managed care contracts. Therefore, we think it's really important to understand, where state Medicaid programs have flexibility, what are some unique things that we're seeing in the Medicaid environment. This is particularly true as Medicaid does provide coverage for long-term services and support. So unlike the Medicare program, actually does provide coverage for those services. And increasingly and relatively a recent phenomenon, moving a lot of those services to be managed by managed care organizations, whereas traditionally the states have retained responsibility for managing those. So it's sort of a new world with respect to Medicaid managed care contracting in this space that has significant implications for us, but also again provides a lot of opportunity given the flexibility within the Medicaid program. At this point, I'd just like to run you through how you access the toolkit and navigate it and what you'll see. Right now, you can go to VNAA.org, and you will see a new tab at the top of the page called Innovate. And if you click on that tab, you will come to our opening page, which gives you a table of contents, if you will, for what you can access in the toolkit. I will mention that you can get to this toolkit without logging into your VNAA account. However, if you look to the left and you see the table of contents there running down the left-hand side of the page, those pages are only available to VNAA members. So VNAA affiliate members, associate members, individual members. You must log in to get full access to all of the pages that are running down the left-hand side. The first tab is our Readiness Self-Assessment. And with this assessment, within your agency, we recommend that you, within the senior leadership team and various leaders from different elements, so clinical, business, financial, et cetera, that you can use this tool to self-assess and come back together and really start the conversation within your agency about what capacity you currently have. The Readiness tool looks at leadership and culture, understanding community needs, where you are today in terms of quality and performance improvement, what infrastructure you have in place for patient and caregiver engagement, your health information technology capabilities, what experience you have with payment reform and taking on risk, and your community partnerships and where you are in the development of those. Our next section is our Payment and Delivery Models 101. And for what you'll get when you log into this section is you will see almost a laundry list of different types of care delivery models and payment models where you can learn more. Here I've pulled up as an example our page on accountable care organizations. And you can see that we've tried to keep these short. They are approximately 1 to 2 pages in length. They review, they provide a description of the model. They talk about which populations the models are frequently used for, what types of entities normally serve as the leads, what can be the role of home health in the model, how providers are reimbursed within the model, what infrastructure requirements you need to pull it off, if there are variations on the model, what those might be, and some additional resources. And under the additional resources, I'll just note that this is the place where you can come to access information directly from CMS, if CMS has a program in this space. And of course, with ACOs, they do. There's a number of different ACO programs available through the Medicare program. This is also where we link to external resources. So if there are particular slide decks, webinars, podcasts, papers, sort of you name it, that we've seen other organizations put out, we'll collect them here. And then finally, and you'll see this here, we've developed some informational videos, some short videos that are approximately 10 minutes or less that help describe what the model is, again, from the perspective of a home-based care provider. These videos were developed by VNAA, again, specifically with our membership in mind. And this really reiterates a lot of the information that's written up here, but helps to do it for those learners like myself who are more visual learners as opposed to, learn by reading. Our next section is speaking the language of value, and this is where home-based care providers can come to learn about what are the metrics that matter for the conveners or the organizations who we will most likely be negotiating with. So this includes hospitals, Medicare Advantage plans, Medicaid managed care plans, bundled payment conveners, and others. And what you can find in this section are the latest quality metrics that they are being held to, because we think this is a really good indicator of what matters to them and how they define value. We, over time, and so this is in development, but over time we hope to be able to highlight within the measure set which are the measures that home-based care providers are most likely to be able to influence, and hyperlink to some of our clinical best practices so that you can learn, for instance, if you look at the measure of improving or maintaining mental health, that we would be able to link to evidence-based guidelines for home-based care providers that would help you in influencing that measure, and therefore be able to communicate to the Medicare Advantage plan how you may be able to help them improve their score on that measure. Our next section is on risk assessment and management. So we have a couple of different sections here. One reviews the different types of risk that you may encounter in sort of this new world. There are clinical and administrative, operational risks, market risks, and financial risks. So we go through those and talk about different strategies to manage those risks. We also, in this section, explore the different risk-based payment models, and that's what you can see here on your screen. What are some of the different payment models that you may encounter as a home-based care provider? What are the core capabilities that you need to be successful in them? And really kind of what level of risk would you be facing in these different models, et cetera. You can see in the left-hand column that we have some member profiles, and these are examples from the VNAA membership of organizations who have already entered into these types of payment models and what they've found. Our star ratings section right now, as I mentioned, is in development, but what you can access now is background information on what are the star ratings, what are the measures that go into them, what is the timeline for rolling out the full complement of star ratings, because of course we will be adding patient experience star ratings in January. VNAA also did a webinar back in June of this year that linked the measures that are part of the Home Health Compare Star Ratings for quality of care and the VNAA Blueprint for Excellence, and linked up already best practices that we have available. Again, we are continuing to build out those best practices, so we will be updating this section as those become available, but some of this already does exist and can be accessed on the website. Similarly, we have a section for the Home Health VBP demo. Right now, again, because this program is in development and it's right now just a proposal, and CMS is may be making modifications before finalizing it. Right now, we just have information on the program as it stood as part of the proposal, and we will be updating this once the final program is available, and increasingly linking, again, to evidence-based clinical guidelines and protocols to help you improve your performance along the measures that are developed. With respect to Medicaid transformation, again, we have a number of different resources that are already a part of this, including Medicaid 101. If Medicaid is not a large component of your business right now, and therefore you don't feel very comfortable in understanding how the Medicaid program works, there are a couple of different resources, sort of Medicaid 101. We also go through some of the unique characteristics to Medicaid that we think are really helpful to know when working with the state or contracting or working with Medicaid managed care organizations. We also have a section on common care delivery models for Medicaid populations. There are a few delivery models that are unique to Medicaid or that are predominantly used with Medicaid populations. So, for example, health homes is a Medicaid construct, as well as PACE. There are also Medicaid ACOs and a few other delivery models like that. And this is the section where you can dig a little bit deeper into what those models are. So with that, that comes to the end of our overview of the toolkit. I will just mention that as of now, it is fall 2015. We are very much still in the development of the toolkit. This is, I would like to call, the beta version of the toolkit. We are building out the sections. We are doing that in a number of different ways, including through submissions of content from within our membership, both our provider members as well as our corporate members. And we're also working with other external organizations like Medicaid Health Plans of America to build out specific portions of the tool. So with this, I will just say that I encourage you to be in touch with VNAA, be in touch with me specifically, if you are interested in learning more or if you think that you have content that you would like to contribute. We also very much seek your input on how we can improve the toolkit and what information you'd like to see to make it most valuable to your organization. So with that, I strongly encourage that you contact me. Again, my name is Molly Smith, and I may be reached at msmith1@vnaa.org. Thank you. I appreciate you taking the time to go through this webinar with me, and please be in touch about any recommendations or feedback that you have on the toolkit. We'd like to make it as helpful as possible to you and your organization. Thank you.